In this video, we'll be talking about diabetes type 2 or non-insulin dependent diabetes mellitus. This type of diabetes is not managed by insulin, but rather PO oral hypoglycemic medications, so we'll see some information on that as well. If you want more information on this subject, you can find that in the endocrine chapters of your nursing resources. So we'll be going over this topic by doing questions. I will read the question to you and then pause. I want you to think about what you would answer before looking at the choices. Then we'll read the choices and discuss what was best. So let's get started. Question number 1. A 45-year-old was admitted to the hospital for complaints of headache, nausea, and blurred vision. Lab studies reveal a fasting blood sugar of 480. He is diagnosed with type 2 diabetes mellitus. Which statement by the nurse is correct? Select all that apply. Is the answer number 1, your pancreas is not making insulin? Number 2, this diabetes is usually associated with being overweight. Number 3, diabetes type 2 is caused by alcohol use. Number 4, you will take medications by mouth to control the high blood sugar. And the answers here are number 2 and 4. So in the question, it's asking for type 2 diabetes, what we know about that. And so everything we can think of. We know diabetes is high blood glucose levels. It doesn't matter if it's type 1 or type 2. But this diabetes is usually from being overweight. And the pancreas just simply cannot keep up with all the sugar in the bloodstream, and it can't make enough insulin to meet the demand. So it's like having a tired pancreas. The other possibility is that the cells have lost sensitivity, and I like to call insulin a key. Insulin is the key that opens the cells to allow the sugar from the bloodstream to get into the cells. And the key is just not working anymore. So that's another possibility. Either the pancreas has an issue or the cells have an issue, or both. And since the pancreas, though, is still making some insulin, they are not insulin dependent and will use instead those PO medications to manage the high blood sugars. So if we went through this, number 1 is false because we do know the pancreas is making some insulin, just maybe not enough. Number 2 is true. It is associated with being overweight and having a lot of sugar in the bloodstream. Number 3 is false. There's nothing about alcohol use in type 2. And number 4 is true. They're not insulin dependent. They will be taking the PO medications, which affect blood sugar in many different ways, which we'll talk about later. So in the further learning, one other risk factor for having diabetes type 2 that I wanted to connect is this metabolic syndrome. Metabolic syndrome sometimes is referred to like a pre-diabetic stage, and just know that the triad of metabolic syndrome is higher blood glucose levels, high cholesterol, and a thicker waistline, if you see that mentioned in your diabetic type 2 conversations. Question number 2. Which statement by a woman newly diagnosed with non-insulin dependent diabetes mellitus demonstrates to the nurse an adequate understanding of dietary needs? Number 1. I need to ensure I eat protein with every meal. Number 2. It is okay to have a few drinks at night. Number 3. I should stop eating all carbohydrates and sugar. Number 4. I should skip meals to lower my blood sugar, which helps the cells become more sensitive to insulin. And the answer here is number 1. So we need to be thinking of the dietary needs of a non-insulin diabetic. And the basic information that should come to your mind is that diabetics need to carefully manage their carbohydrates, not that they can't eat them, because that's our fuel for our muscles. We still need to eat that. But it should be balanced out with protein because that slows the glucose absorption into the body and balances it out a little bit. So that's why number 1 was the answer. And actually number 4 is very dangerous. We don't want any diabetics skipping meals, and they have to eat as advised, because if they're like in a type 1, if they're taking insulin, or in this case a type 2, they're taking an oral hypoglycemic, if they don't eat for some reason, they could end up going hypoglycemic from their treatments. So it's very important to eat as instructed for these people. Number 3, the nurse is teaching a type 2 non-insulin dependent diabetic about acute hyperglycemic complications. The primary reason a type 2 diabetic does not usually develop diabetic ketoacidosis is. Number 1, there is no insulin available for the state of hyperglycemia. Number 2, the type 2 diabetic has no fat reserves. Number 3, there is some insulin which is always supplying some glucose to the cells. Therefore, the cells never have to turn to using fat for metabolic needs. Number 4, the client is resilient to acidotic states. And the answer here is number 3. So it's basically asking you the difference between HHS, that hyperglycemic, hyperosmolar syndrome, and diabetic ketoacidosis. And the only difference is that there is no ketones in the type 2 hyperglycemic complication. And so the thought is that why isn't there any ketones? Why doesn't the body need to eat fat? And that is because the cells always will have some glucose to use because the pancreas is always making some insulin, so some glucose will always be getting into the cells. And therefore, the cells will never have to turn to using fat for energy like they do in the diabetic type 1, and that's when those people produce the ketones. So in the further learning, make sure that you do know the difference between the hyperglycemic hyperosmolar syndrome, HHS, or actually I prefer to call it HHNK because that reminds me hyperglycemic hyperosmolar non-ketotic, which becomes the only difference between that and diabetic ketoacidosis. Number 4, the primary caretaker for a man who was recently started on an oral hypoglycemic agent is asking, how will I know if he is having side effects from the medication? The nurse should respond. Number 1, blood sugar readings around 100. Number 2, increased short, shallow respirations. Number 3, presence of glucose in the urine. Number 4, cold sweats, weakness, and trembling. The answer here is number 4. So it's asking for the side effects of oral hypoglycemics. Well, oral hypoglycemics can cause hypoglycemia. And the first signs are sweating, diaphoresis, nervousness, confusion, tremors, headaches, impaired vision. Later issues can be even seizure and coma. So number 4 is the answer. And it's important to know the difference between hyperglycemia and hypoglycemia. Something that I try to do when I study is know the similarities and the differences. And in this case, the similarities between the two are headache, vision changes, and weakness and fatigue. You can see that in both high blood sugar and low blood sugar. Question number 5. Which of the following statements by a person who has diabetes mellitus shows the nurse that he has adequate understanding of special foot care needs? Is it number 1, I like to go barefoot in my house? Number 2, I like to use a heating pad at night as I always have cold feet. Number 3, I'm going to wash and examine my feet every night. Number 4, I will cut my toenails when they get too long. And the answer here is number 3. We need to teach our diabetics about foot care, and it's asking what they should know. And diabetics can have very poor blood flow to the extremities because their blood is full of sugar or glucose, and if you were to pour sugar in a drink, it would make it thicker. So these people have very thick blood, and it's harder for the heart to push that thick blood down to the feet, and the feet end up not looking too good. And so they need to be assessed. They could be getting wounds there and not even know it. They could have signs of infection. So the picture on the screen actually does not look like a diabetic's feet to me. They're very pink and healthy. Usually you see them and the nails look kind of off. There's no hair on the legs. They're a bit paler. They could have wounds that won't heal. And so you always want to check the feet. So in the answers, we definitely don't want the client to go barefoot because they could not feel what they're stepping on. If they get a wound, it might not heal. We don't let them use heating pads because they might not be able to feel how hot the heating pad is. And definitely they should be getting their nails cut by a podiatrist because if they cut their nails and they get a wound, it's going to be hard to heal. even nurses are really not supposed to be cutting diabetics' feet. So in the further learning, make sure that you always take off the socks and shoes of your diabetics, check them out, make sure there's no wounds, check capillary refill, because the problem is diabetics can't feel because they might have neuropathy. Some of their nerves in their extremities have died and they just can't feel it. And also those wound infections are from the blood is delivering sugar to the areas, and bacteria loves to grow on sugar. So diabetics are at high risk for bacterial infections. And then also wounds can't heal because sugar is going to that area instead of all that nutrition and oxygen that the blood should contain. So also in the further learning, it's just important to make sure as you're assessing your diabetic, don't just be locked in on the hyperglycemia or even just, adding the feet, but also think of all the problems with diabetics, such as trying to pump that thick consistency of blood all the time could enlarge their heart. It could eventually lead to heart failure. It leads to high blood pressure. It leads to that thick pressure hurting the kidneys, nephropathy. Make sure the kidneys are okay. Are they going to the bathroom? What's the BO and creatinine? A lot of people with diabetes can end up on dialysis. How's their eyes? The thick pressure, sugar-filled blood, it destroys their eyes. It can cause retinopathy and vision changes and glaucoma. So always check your other organs too that are affected by diabetes. That's diabetes type 2. Hope you enjoyed learning through the questions, trying to critically think, choosing the best answers. If you like this video, we have more like these. Subscribe to our channel, and please don't forget to like this video, and you can find us at sinestrategies.com.